Welcome back to the deep dive. We're jumping straight in today.
We are.
We're tackling something that, well, it affects almost everyone. Navigating modern healthcare. Specifically, how do hospitals actually make sure they're providing quality care?
And importantly, what does that mean for you, especially if you're seeing, multiple different doctors?
Exactly, that juggling act.
So for this deep dive, we've pulled together quite a bit of material.
Okay.
We've got info from major accreditation bodies. Think international ones like Joint Commission International or JCI.
Heard of them? Global reach.
Big time.
Yeah.
And also national ones like India's NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Got it.
We also looked at a healthcare consultancy, Supreme Medic, for a different angle.
Right, support side.
And various articles, notes, focusing on this challenge of coordinating care when lots of specialists are involved.
So our mission here is to kind of cut through all that complexity.
Yeah, distill it down.
And give you the essential takeaways. A shortcut, maybe, to understanding how quality is managed.
And crucially, provide some, practical things you can actually do when you're in that situation with multiple doctors.
Right. Actionable insights. This is really about empowering you.
Mm-hmm.
Okay, so let's unpack this. The reality for so many people now, healthcare isn't just one doctor anymore, is it?
Not often, no. Especially with chronic conditions or anything complex.
You end up with a whole team, maybe.
You often do. A cardiologist, maybe a neurologist, an endocrinologist. The list goes on.
And that's generally a good thing, right? Having that specialized knowledge.
Oh, absolutely. It's
Yeah.
beneficial. Each specialist brings incredibly deep knowledge in their area, very focused care.
And here's the big but. What happens when they aren't, connected? When they don't talk?
Ah, yes. That's exactly where the sources highlight the major risks. It can really fall apart.
How so?
Well, you can get conflicting advice from different doctors.
Oh, that's confusing.
Very. And you might end up getting the same test done twice. Wasted time, wasted money.
Yeah.
Or a symptom that one specialist dismisses might be a really important clue for another specialist if only they knew about it.
Missed connections.
Exactly. And probably the most dangerous part is polypharmacy.
Okay, what's that?
That's when you're taking multiple drugs prescribed by different doctors who don't know the full picture.
So they could interact badly.
Dangerously so.
Yeah.
Yes. It's a huge risk.
Mm-hmm.
Overtesting, misdiagnoses, general confusion. It all stems from poor coordination.
One source used a great analogy for this.
Which one?
It said, without coordination, multi-specialty care isn't a symphony. It's more like a shouting match.
That captures it perfectly. Everyone's playing loudly, but there's no harmony, no conductor, just noise.
Chaos.
Precisely. And the goal, what bodies like JCI really push for, is moving towards highly reliable care. Meaning consistent, safe, effective care. They talk about aiming for a future of zero harm.
Zero harm. That's ambitious.
It is. But you can't even approach that goal without solid coordination. It's foundational.
Okay, so this is where it gets really interesting for me. How do clinics try to build that foundation? How do they move away from the shouting match?
Well, this is where those accreditation bodies we mentioned come into play. JCI, NABH.
They set the rules.
They set in rigorous standards, yes. It's voluntary for organizations to pursue accreditation, but meeting these standards demonstrates a serious commitment to quality and safety.
Like an external check.
Exactly. Think of them as independent auditors for healthcare quality.
So tell me more about JCI. You said they're global.
They really are. A recognized leader worldwide.
Right.
Operating over 70 countries across, Asia, Europe, the Middle East, Africa, Latin America.
Wow.
They've accredited or certified over 1,000 programs. Their whole mission is about enabling and affirming the highest standards possible everywhere.
And how do they do that? Just publish rules?
Oh, it's more than that. They publish very detailed international standards, yes, including the International Patient Safety Goals. Those are really specific targets.
Like what?
Things like ensuring correct patient identity, improving communication among caregivers, medication safety, reducing infection risks, preventing surgical errors, critical stuff.
So practical things hospitals need to focus on.
Absolutely. And JCI offers training, advisory services. They publish manuals, white papers. They provide resources like webinars, online tools. They really support organizations in the process.
It sounds like a huge undertaking for a hospital to get accredited.
It is. The sources highlighted testimonials saying it's a real team-building exercise internally.
I bet.
It forces better coordination, better communication within the hospital itself.
So it has internal benefits too.
Definitely. It boosts community confidence, helps manage risks better, and fundamentally, it helps create a culture that prioritizes patient safety. They even have newer things like pathways for specific safety issues and sustainability certifications now.
Interesting. And NABH does something similar, but focused on India.
That's right. NABH is the National Accreditation Board for Hospitals and Healthcare Providers in India, part of the Quality Council of India.
Okay.
They establish and operate accreditation programs tailored for the Indian healthcare context, setting benchmarks, trying to build what they call an ecosystem for quality.
So similar goals, different geography.
Essentially, yes.
Yeah.
Bringing that same focus on standards and processes to the national level. And we saw NABL mentioned, too, which focuses on labs.
Right, so different parts of the system get accredited.
Exactly. It shows this focus on standards isn't just for the main hospital operations.
Okay, meeting these standards from JCI or NABH sounds like, well, a massive job for any hospital. Not simple.
Not at all. It requires a deep understanding of the standards, changing processes, training staff, ongoing monitoring. It's a complex process.
Which is where consultants might come in.
Precisely. This leads us to the role of healthcare consultancies.
Like Supreme Medic, which was in our source material. How do they fit?
Supreme Medic is described as a partner that helps hospitals on this journey. They work with different types of facilities, nursing homes, multi-specialty, super specialty hospitals, diagnostic centers.
And what do they do?
A range of things. They help with the initial planning and design of hospitals, but critically, they offer support for achieving accreditation, like NABH implementation.
Ah, so they guide hospitals through that process.
Yes, and they help with operations management, too, developing standard operating procedures, SOPs, analyzing workflow, calibrating medical equipment.
Making sure things run smoothly and correctly.
Exactly. Manpower planning, recruitment, training, even legal and ethical compliance support. They seem to offer quite comprehensive services, including providing infrastructure like modular OTs or medical gas pipelines.
So they're like the behind-the-scenes experts helping hospitals meet those big JCI or NABH standards.
That's a good way to put it. They translate the high-level requirements into practical, operational reality for the hospital, helping them build the systems, manage effectively, and meet the standards for quality and safety. Got it. Okay, let's pivot back slightly. We've talked about standards and support systems, but let's focus again on that multi-specialty coordination piece. How do the providers themselves, the doctors and hospitals, try to make it work?
Right. From the systems perspective, it's hugely important for them too. Good coordination isn't just good for patients. It improves outcomes, reduces fragmentation.
Avoids those duplicate tests and errors we talked about.
Exactly. Saves costs, increases efficiency, and leads to higher patient satisfaction. So they want it to work.
So what strategies do they use, according to the sources?
A key one is establishing interdisciplinary teams.
Bringing everyone together.
Yes. Getting the different specialists, the primary care doc, nurses, maybe social workers, pharmacists, all discussing the patient's case together.
But that requires good communication, which you said can be a challenge.
It's absolutely vital and, yes, challenging. They rely heavily on tools like electronic health records, EHRs, trying to get everyone on the same digital page.
If the systems talk to each other, that's the key if. They also use secure messaging platforms and hold regular team meetings or case conferences.
Okay.
Another big strategy is shared decision-making.
Involving the patient?
And their family, yes. Making sure the care plan reflects the patient's goals and preferences, not just what the doctors think is best in isolation.
That feels important.
It is. Developing comprehensive care plans is part of this. A clear roadmap outlining services, goals, responsibilities.
What else?
Ensuring smooth transitions of care. That handoff, when a patient leaves the hospital or goes from one specialist to another, that's a high-risk point for information getting lost.
Yeah, I can see that.
So systems try to put processes in place for better handoffs. And technology is playing a bigger role. Specialized care coordination software, web tools to track patients.
But it sounds like there are still significant hurdles. The shouting match still happens sometimes.
It definitely does. The sources are clear about the challenges. Communication barriers are huge, different EHR systems that don't interoperate, doctors in separate practices. Big silos. Lack of standardized process is another one. What one clinic does for referrals might be totally different from another.
Makes it messy.
Very. And resource constraints are real. Doctors and nurses often just don't have enough time for extensive coordination calls or meetings.
And getting patients involved. That can be tough, too.
Yes. Patient engagement difficulties were mentioned. Patients might not know how crucial their role is or feel empowered to speak up.
Despite the challenges, Are there specific places or models where this coordination seems to work a bit better?
Yes. So sources point to a few examples.
Yeah.
Multi-specialty clinics, where various specialists work under one roof, often helps.
Easier to bump into each other in the hallway?
Sometimes it's literally that simple. It facilitates informal communication. Also, models like primary care mental health integration explicitly try to connect different types of care.
Okay.
And then there are things like accountable care organizations, ACOs. These are more about payment structures that incentivize providers to work together for better quality and cost management for a specific patient population.
Right, aligning financial incentives with coordination.
Exactly.
Okay, this is incredibly helpful context. We've seen the push for quality via JCI and NEBH, the role of consultants like SupremeMedic, the strategies and struggles providers face with coordination. But now let's really move it home. Let's talk about you, the listener. As the patient in the middle of all this, you have a massive role to play, don't you?
A vital role, absolutely. If we're sticking with the symphony analogy, you or maybe a trusted family member, you're the conductor.
The conductor. Why?
Because you are the one constant. Doctors change, specialists come and go, but you are present through the entire journey. You hold the score, potentially.
Okay, I like that. So what tools do we need in our conductor's kit? What can you, the listener, actually do?
The sources give some really practical, actionable advice here. First, and maybe most importantly, maintain a centralized health record, your own master file.
Like a binder or an app.
Either works.
Right.
A physical folder or a secure digital place. The key is to keep copies of everything.
Prescriptions, test results.
Discharge summaries, doctor's notes, imaging reports.
Yeah.
Everything. Actively ask for copies after appointments or hospital stays. Don't assume they'll automatically share it all.
Okay, step 1, become your own record keeper.
Absolutely. Related to that, keep a simple timeline.
What does that look like?
Just a basic log. When did key symptoms start? Which doctors did you see and when? What treatments were suggested? How did you respond?
So a quick history for any new doctor.
Exactly. It saves them digging and gives context fast.
You mentioned the risk of polypharmacy earlier. Medications sound critical here.
Hugely critical. Keep a detailed, up-to-date medication log.
What needs to be on it?
Drug name, dose, when you take it, the reason you're taking it, and this is important, which doctor prescribed it.
Ah, so you can trace it back.
Yes. And the absolute golden rule here. Always, always tell every doctor you see about all medications you are currently taking.
Even over-the-counter stuff. Vitamins.
Everything. Prescriptions. Over-the-counter meds, vitamins, supplements, herbal remedies, homeopathy, Ayurveda. Anything you're putting in your body for health reasons.
Yeah.
Hiding something can be genuinely dangerous.
That's a really strong point.
Yeah.
What if keeping track feels overwhelming?
That's understandable. If possible, designate a point person. A family member, a trusted friend, someone who can help manage the information, maybe attend appointments with you.
Having an ally.
They can make a huge difference.
Okay, what about during the actual doctor's appointment? Any tips?
Yes. Bring your records, or at least a summary of recent tests and your full medication list.
Be prepared.
Definitely. Clearly tell this doctor about treatments you're getting from other doctors. Don't assume they know.
Okay.
And then ask the crucial connecting question. Something like, okay, you're recommending this treatment. How does this fit with, or maybe interact with, the plan from my cardiologist or whoever your other specialist is?
That directly puts the coordination question on the table.
It does. It prompts them to think about it and hopefully either reach out to the other doctor or explain why it's okay.
Makes sense.
Also, try to keep one doctor in the loop about everything. Often a primary care physician, PCP, or an internist. Make them your sort of home base.
Your overall overseer.
Exactly. Make sure they know whenever you see a specialist or your treatment changes. You can also ask your specialist directly. How do you communicate with my PCP? Or does this hospital system have ways for doctors to share information easily? Ask about multidisciplinary meetings for complex cases too.
So being proactive isn't just about scheduling, it's about driving the communication too.
Absolutely. You have to take some ownership of following up, making sure information gets where it needs to go.
Okay.
And another tip, prepare a list of questions before you go to each appointment.
So you don't forget in the moment.
Right. It helps you stay focused and make sure you get your key concerns addressed.
And what about technology? Can that help the patient?
It certainly can. Use patient portals if your hospital or clinic offers them.
Those websites where you can see results.
Yes. Often you can see test results, appointment summaries, maybe request refills, or even send secure messages to your care team. They can be really useful. Check if your different specialists are perhaps part of the same larger health system. Their electronic records might be integrated, making sharing easier behind the scenes.
Wow, okay. That was definitely a deep dive. We've covered a lot of ground.
We really have.
From the big picture standards with JCI and NABH to the support from consultants like Supremedic.
To the strategies and, let's be honest, the real-world challenges providers face in coordinating care.
And finally, landing on practical tools and strategies that you, the listener, can use to essentially conduct your own healthcare symphony.
This is the key takeaway, I think. By staying organized, being proactive, asking questions, and communicating clearly, you really do become an active, essential member of your own care team.
You can genuinely impact how well your care is coordinated.
Absolutely. You can reduce risks, avoid confusion, and help make sure that multi-specialty care works for you safely and effectively.
Fantastic. So, as we wrap up, let's leave our listeners with that final thought to chew on, building on what we've discussed today.
Okay. It goes something like this. If knowledge is most valuable when it's understood and actually applied, and we know that coordinating complex multi-specialty care really hinges on shared decision-making and active patient engagement.
Right, everyone playing their part.
Then how much more effective could healthcare truly become if that symphony genuinely involved everyone, doctors, nurses, patients, families, all playing from the same well-understood musical score?